So, again, I want to thank all the essential workers, non-essential workers, everyone that's doing the right thing. And, I guess like in all political jobs, right, you sometimes got to eat the words you cherished a few days ago. And I was really proud when we sat here and we said we're the second, tied for the lowest in the state of New York. And everyone is doing everything right. But things change, and unfortunately, this morning, there are now 2,053 positive cases of the coronavirus in Albany County. 544 people in a mandatory quarantine and 77 active cases. So I'm going to break it down a little bit because it is alarming, because if you think the last time we came close to that number was June 1st with 37 new positive cases, May 22nd with 41 new positive cases, May 20th with 71 new positive cases. April 25th we had 80, April 24th we had 45, April 18th we had 47, and April 16th we had 48. So yes, that number is alarming for multiple reasons. But between April 16th and April 25th, we had numbers in the mid to high 40s and 80s on April the 25th. We had our highest one-day number of 94 positive cases on April 30th. So what does the dates of April and May dates have in common with today? And we broke it down and we looked at it. Why are we spiking now at this time? And the other numbers that I just threw at you. And they're all around holidays. Passover, Easter in April, Mother's Day in May. Many of those days with high positives fell in the 14-day window, when we've been saying it could take us up to see that. It could be anywhere from 7 to 14 days and a little bit longer. Happened as a result of people gathering together in large groups. That's why we continue to sit here. We have for the last 127 days and almost 19 weeks of wearing a mask, coughing into your arm, and cleaning your hands. There's a cluster on the 4th of July party in Albany where we had up to 200 people that were there, not socially distancing, not wearing masks, not doing the right thing. So we have 6 known positive cases from that party so far, and still continuing to have the epi people chase down the people, and Dr. Whalen and her team are doing a fantastic job doing that. We also now we have 4 cases from people who flew into Albany in the last 2 weeks from Georgia, Florida, Cancun, and Michigan. So people who decide to go traveling and not do the right things have come back positive. That's, again, that ripple effect of tracing, and it's like that domino. How many people have they met, and how many people are they going to knock down as we go along? We also know that we've had 2 cases from people that drove from South Carolina and Florida back to Albany, the winter homes, that were positive. Also included in today's positives are the healthcare workers who are tested weekly, and there are 8 residents at St. Peter's Nursing Home, Rehabilitation, and Nursing Center, which we all know one worker went on vacation, I believe, to Georgia or someplace, came back and infected the work area. So, but there is some good news when we look at these numbers, and you have to try to figure out the good with the bad. And when we looked at the numbers, we still only have 2 people in the hospital, which is good news. No one in the ICU, which is also good news. And if you look at the people the number of people that were hospitalized in our high periods in April, May, and June, you'll see we had the numbers of people hospitalized in their 20s and 30s within our ICU numbers ranging from 1 to 10 people. Our hospitalization rate today remains at 0.09%, which is good. Over the last 5 days, though, our average now is 16 new positive cases each day. And we've had 6,176 people have completed quarantine, and out of those, 1,976 tested positive for the virus. 5 have recovered out of that number, which is also good news. So there is good news, because thank goodness, we're not seeing the hospitalization rate go the other direction, hospital beds go the other direction. Not saying that could not happen. Thank goodness we haven't had anyone pass away. So that's good stuff. but it's still alarming when we're having holiday parties, barbecues, and everything going on, and we've sat here and we told people, please, I know you want to do this, socially distance, wear a mask, stay 6 feet apart, do the right stuff. And I jokingly said, you probably won't have to see me every day again. And unfortunately, with these numbers, if it continues this way, and when I'm hoping, Dr. Whalen and I have discussed this, and we looked at this internally, as the numbers climbed up steadily the last couple of days alone was alarming enough when we were hitting 9 and 10. But to hit this number from yesterday today is alarming, and you will probably see more upticks in the next couple of days because of people that are at these parties. So we will say to people, if you're at holiday parties, if you aren't socially distancing, please go get tested, or just get tested and stay home for 14 days, please. Because again, I've said this to you time and time again, the virus is still here. It's not done with us. I know most people feel like Superman, that they don't have to worry about it because they don't get sick. They don't have underlying health issues, and that was one of the things that really I kind of took a step back when people are saying, well, the person died. I just want to know, did they had health issues? Doesn't matter. They passed away. But I know that makes people feel good. Well, it's not affecting me. But this type of behavior is going to keep us in this category. And the last thing I want to do to businesses, as we're struggling to get back to 100% workers here in the county, because we still don't have all of our workers back yet, as businesses continue to try to open up, the last thing I want to say is that, hey, look, you got to close down. We got to go back to nobody inside restaurants. We have to go back to no gatherings. As people are trying to get more and more people, we went from 25 gathering up to 50. I know people like my daughter, who's supposed to get married in May, then August, then October. We're still waiting. We don't know what it will be like in October and November, but if we continue to go down this path, it's going to be a long process. It's going to be a long process. Please schedule appointments. You got the drive-through at Albany. You can call. It's free. They don't ask you for health care. They don't ask you for anything. You have the Seth Q Arena, so you can call the number at 1-888-364-3065. And our mobile testing site's still up and running. Please, you can make an appointment if you don't have insurance. We pay for it. 518-465-4771. And as always, Rite Aid, go online. RiteAid.com is still up and running in the town of Colony. Priority 1 in Gilliland, also doing the antibody testing. You can call them at 518-867-8040. So, just a couple things. The governor has required people to quarantine for 14 days, as we're aware of, that travel to and from the 22 states with infection rates have been raising to dangerous levels. As if you're not watching the news or reading stuff online, please do, and pay attention. 10% of the higher of the total population tested positive on a 7-day rolling average, it's alarming. It's alarming. I think, I talked about how Orange County, Florida opened up Disneyland, but yet they had a 120% spike the day before, which is crazy. We got to take this more serious. And to the people that want to go see loved ones and they got connections and they want to see their family, they just want to get away, please stop thinking of yourself. Think of your neighbors. Think of the people around you. Think of the community stepping back. And that's what's going to continue to happen if this continues to spike in that direction. As you know, there's new travel enforcement options at the airports that started yesterday, so be aware of that when you're traveling. Again, people coming back from other states that are driving, please do the right thing. Self-quarantine for 14 days. Go through Albany, get the testing done, and do the right thing. I was actually happy to see that the Siena College poll found that 73% of New Yorkers always wearing a protective mask when they leave their house, which is good. However, 56% said they completely trying to follow state guidelines on social distancing. Obviously, 56% of the people we need to improve. So, something we all need to work on and enforce. And I know it's hard. I can't tell you how many times I've walked out of my car and I forgot my mask. Or coming down to these press conferences, I'm like, whoop. I go, and you think I'd be just used to having it and putting it on. I know it's tough for people. one of the key ways to stopping the virus from going forward is by wearing your mask and doing the right thing. It's simple. We talked about we're going to be sending posters out to all the businesses on how to properly wear a mask. I can't tell you how many times, and Dr. Whalen says it the best when she shows how to wear the mask. You go in and it's hanging under their nose. Even though there's a shield there, they should be wearing it right. And these are things that we need to continue to train because we're not used to it. Not under your chin, as Dr. Whalen has said, and I'll let her talk about that. But Dr. Whalen, would you like to add anything?
Thank you, County Executive McCoy. So in terms of the increased numbers that we've seen today, I do think that it is likely a reflection of the 4th of July holiday weekend. The party that was referenced that we have 6 cases currently tied to was not at a single home, from what we're hearing, but in a large area of backyards on Hudson Avenue in New York, in Albany. So if you were at that party on Hudson Avenue in the backyards, please consider being tested. Please get tested. We need to stop this. We need to make sure that those that are infected don't continue to spread this disease to others. I have been looking at the national news as well, and I think that, I would like to express some caution with the good news that the rates of hospitalizations and deaths are low. What we saw previously with COVID is that first we saw the spike in cases, and then about a week to 2 weeks later, we saw a spike in hospitalizations and started to see deaths. This is not what we want to have happen. So I say that because I don't want to give the message that these infections are not potentially harmful to people. COVID is a novel virus. This means it's new. This means we are constantly learning about how the virus behaves. It is a situation that none of us have ever been through in public health since 1918. I myself have been in medicine for 28 years. I've been a doctor. And I will say a couple of things. First of all, this is something we're learning about, and information is getting out to the public in real time. So the medical professionals are learning about things often at the same time as the public. The information, as we learn based on evidence and science and numbers, can sometimes change advice that people are getting. The unfortunate piece of this is that people are saying, therefore, they've been misled, or that information was purposefully miscommunicated. And that doesn't help any of us. It doesn't help any of us in our cause to stem this. I'm not getting any secondary gains, believe me, by having increased numbers of COVID in the community. I don't know any doctors that are benefiting from this. All of us want the health of our patients if we're in practice, and of our communities if we're in public health. That is our mission. That is what we work towards on a daily basis. And the information that we provide in a very responsible manner based on the evidence that we have at the time. To allow these conversations around conspiracy theories and mixed messages just isn't helping us. And I would really urge the public to continue to trust the medical professionals that have trained for years to be able to respond to a situation like this. We in public health in the county health department have trained for pandemic preparedness. I started working at the county health department in 2003. When I came in, we were doing drills there for pandemic preparedness. We have worked very hard on this, but it's still new to us as well, what we're seeing, how this virus is evolving and changing. So please know that the messages that we provide are for the public's protection. We do not want to see a spike in serious illness. We do not want to see a spike in hospitalizations. And most of all, we do not want to see additional people needlessly dying from this disease that could have been prevented by something as simple as wearing a face mask, washing your hands, and keeping social distance. So please realize that that message is more important today. It's more important every day. Continue these very simple behaviors so that we can continue to move forward.
Thank you, Liza, and well said on all that. And it is tough, and everyone's trying to do the right thing to get past all this. And I've said this before, and I was hoping I wasn't right when I said it's a marathon, not a sprint. And obviously, 18 weeks into it, we're going to be into this for a longer time to come. But yet we still have to keep moving forward, putting our best foot forward, and continue to reopen and do it safely, because the health and safety of the residents are first and foremost my most responsibility as county executive. So keeping that in mind, please continue to do the right things. Our region now is at we're the highest in the state of New York, capital region, at 2.1% compared to other places. And just to put it in a little bit of idea, New York City was at 1.3%. And, so we have to watch that number. We have to continue to keep it low with hospitalization rates and everything else, and hospital beds and ICU beds. But I can't do that without you. We can't do this without a partnership. We can't do this without people buying into it. And I'll say this, I can't argue the science. I can't argue the health side. I leave that to the doctor. I say to people that think it's not real, talk to your doctor, go out and, we got the mental health line set up if you need to talk to somebody about different things. We don't have all the answers. It's what we're dealing with. I'm not going to compare it to the flu numbers and everything else. I would spend all day trying to answer all your questions that people throw at me via different areas in social media and seeing them on the streets. All I can tell you is that we're in this together, and we'll get through this together, working together and having each other's backs. And again, I say to people who don't want to wear a mask, don't go out in establishments. Go for walks by yourself. This county's pretty big. The Capital District's pretty big. Go exploring, go hiking, go to Six Rivers, go to Thatcher Park, go to Lawson's Lake. Go by yourself. If that's what you want. No one's forcing you to go into restaurants and into places like that. So please, by all means, continue to be courteous to the workers and to the people around you. So I want to just say that before I move on. I know, Liza, if you had something else you wanted to add? Go ahead.
I just, again, urge people to continue to do the right thing. You know what you need to do. We've been saying it every day. Just do the right thing so that we can come back here, or not come back here, not have to come back here.
True.
We want to keep the cases low. We want to keep people safe.
Absolutely. So some just good things before we end. Monday I announced, and thanks to the success of the Albany County Stay Safe Teen Challenge, working with Albany PAL and AT&T, can't thank you enough, tried to engage kids, give them something else to do, to keep them preoccupied through these tough, challenging times, and practice social distancing, wearing a mask, washing your hands frequently, all that good stuff, to curve this. So thank you to all them, and thank you to all the kids that actually sent neat stuff in. But for week 9, the theme is change the world. And I kept saying reimagine early on, change the world. We're in your hands to the next generation of kids out there, and college kids and kids going into college and young adults. Change the world. Help us move forward and tell us what you reimagine, where we're going forward. So that's the challenge for week 9. But I do want to say to the kids that are out there between the ages of 13 and 18 who posted the photos or videos or how the world is changing and how it's going to look to them, please, thank you for participating. As always, it's a $25 gift card. Can go a long way buying a game or doing something else. So our week 7 winner was Dunbar from Voorheesville. She makes her favorite home-cooked meal, chicken Alfredo, which I do love, so I will take you on that challenge and come to your house when this breaks to have that dinner with you. No, she didn't ask me. I'm just inviting myself, to be honest with you. So again, thank you to everyone that does that, and to the businesses out in Albany County. Even in Rensselaer and Schenectady, if you need hand sanitizers or any PPE or anything like that, please call. Go to our TU center. As always, we put that number up in Sheriff Apple's EOC to help out with different things. Mental health hotline is up and running as always, 7 days a week, 8 a.m. to 5 p.m. And the number is 518-269-6634, 518-269-6634. And our 24-hour sexual assault hotline number, 518-447-7716. As always, the New York State hotline and the United Way number. And again, I do want to say thank you to everyone. It is a partnership, and we are in this together.